When a child needs surgery, specialized care matters. Joining us now to discuss pediatric surgery and the benefits of having expert care close to home is Dr. James Geiger with Nationwide Children's Toledo. Thanks for being here today.
Thanks so much for having me.
Absolutely. So you must really love kids, huh?
I do love kids. Yeah, it's amazing to work with kids, and obviously we love to see them get healthy again, which is always our goal. But yeah, they're very resilient and really fun to work with.
Yeah. So what are the most common procedures that you all would typically do with kids?
Yeah, so as a pediatric surgeon, we do a lot of emergent and urgent surgeries, probably about 40% of what we do. That would usually, the most common operation there would be appendicitis, very common condition. And then for more elective surgeries, usually we're dealing with hernias, inguinal or groin hernias, as well as umbilical hernias. And then we also do full range of surgery, though. We do everything from cancer surgery, other congenital anomalies that children are born with that require fixing. So it's a very broad field. Yeah,
but you specialize in kids because kids are different than adults.
Absolutely.
And so why is it so important then for parents to make sure their children are being seen then by a pediatric surgeon?
Well, a pediatric surgeon, to become a pediatric surgeon, you have to do 5 years of general surgery training. And then a lot of pediatric surgeons, because it's a competitive field, will do some extra academic time and then a 2-year fellowship in pediatric surgery. So they come out very well trained to take care of kids. And they are different in different age groups, from a premature baby up to, adolescents and young adults. So it's really important to have a surgeon that has that additional training for your child.
What is it like? Maybe one day you're operating on a toddler, and then the next day a teenager comes through.
Yeah, you have to shift gears, both not only in how you deal with them before the surgery and relate to them to help them feel comfortable, and then also obviously the conditions they have and understanding them, and then the operative differences. But yeah, that's also what makes it a fun field to practice.
Kind of changes a little bit every day,
a lot of variety.
Yes. There's a unique partnership here in the Toledo area between Nationwide and ProMedica's Russell J. Ebide, right?
Yes, it's really exciting. The resources that Nationwide has brought to Toledo is, for instance, I have 3 other partners. So we have 4 full-time pediatric surgeons in Toledo because of this unique partnership. And really, we're just getting started, I think, here in Toledo for kids' care with Nationwide support and sort of collaborating with them. I think we're going to really be able to do amazing things and build programs for the kids of Toledo.
Yeah, and if a kid ends up in the ER, then, for instance, would someone from your team get called, or how would that work?
Yeah, so right now there would be 2 sites, either at the Nationwide Children's Toledo site or at Ebide Children's emergency room, and then somebody from our team would see them. We have a great team of advanced practitioners, as well as we work with the residents at both programs, and then they would, discuss the case with us, and then we come in and take care of them if needed.
Okay, and it's something that a parent never wants to have to do. Take their kid to the hospital, have them go under, for instance. So what does that, how do you work with the families to talk with the parents, talk with the kids, help get everybody through these situations?
Yeah, it's a really good point, because for us, I wouldn't say ever I consider surgery routine, because even the simplest surgery can have issues happen. And for that family, it might be a highly stressful event for them. So we just do everything to, make sure they understand exactly what's happening, answer all of their questions, and then depending on the age of the child, explain as much as we can to them. I always try to involve the child in the discussion and have them have their understanding and answer their questions too, so that everybody feels as comfortable as possible and reduce the stress as much as possible of them going to surgery.
The kids are probably asking questions like, am I going to be able to play my Switch tomorrow? And then the parents are asking questions, how is this going to impact them 10 years down the road, right?
Yes, they always have interesting questions. I just had a young kid ask me, what color is my blood? I thought that was funny. I said, well, that's a complicated question.
It's
red and blue, but yeah, they have always amazing questions.
Yeah, and providing amazing care here too for our kids so that they can live to have these long, happy, healthy, strong lives. So thank you so much for coming today.
Oh, thanks so much
We
for having me.
appreciate it. And again, as we mentioned, you don't necessarily want to see
No.
Dr. Geiger, but he's there for you
Yes,
just in case.
We're here if you need us, for sure.
Thanks for being here.
Thank
Appreciate
you.
it.